So next, I would like to talk about side effects associated with metastatic breast cancer. Cancer cells tend to grow fast, and chemotherapy kills fast-growing cells. But because these drugs travel throughout the body, they can affect normal, healthy cells that are fast-growing too. Damage to healthy cells causes side effects. Side effects are not always as bad as you might expect, but it is normal to worry about this part of cancer treatment. Doctors try to give chemotherapy at levels high enough to treat the cancer while also keeping the side effects at a minimum. So the goal is to treat the cancer while also helping you maintain an optimum quality of life and for you to continue doing things that you enjoy. What you need to know about side effects is that every person does not get every side effect. The severity of side effects varies from person to person. Ask your cancer care team about which side effects are most common with your chemotherapy, how long they last, the severity, and when to call your doctor's office. Your cancer care team may give you medication to help with the side effects. Some chemotherapy drugs can cause long-term side effects. Ask your care team if the chemo drugs you are getting cause any long-term side effects. So while side effects can be unpleasant, they must be weighed against the need to kill the cancer cells. Be sure to talk to your care team about which side effects are most common with your chemo, how long they might last, how bad they might be, and when you should call your doctor's office about them. Everybody is different in what side effects they experience. It may be helpful to keep a journal and write down what you're feeling that day. That way you can pick up on trends of side effects you're experiencing and also have record of side effects you had to take with you to your doctor's appointment to discuss with your cancer care team. So common side effects from chemotherapy can be fatigue, hair loss, easy bruising and bleeding, infection, anemia, which are low red blood cell counts, nausea and vomiting, appetite changes, constipation, diarrhea, mouth, tongue, and throat problems such as sores and pain with swallowing, peripheral neuropathy or other nerve problems such as numbness, tingling, and pain, skin and nail changes such as dry skin and color change, weight changes, chemo brain, which can affect concentration and focus, mood changes, changes in libido and sexual function, and fertility problems. Now remember that just because a side effect is listed, it does not mean you will experience that side effect. And there are side effects that bother you as the patient and side effects that bother your care team. However, all side effects you experience matter, and your care team is available to help you manage those side effects. Never hesitate to call your doctor's office with questions or concerns, because we are here to help you through this journey. Now, when looking at how best to combine chemotherapy drugs, doctors must look at interactions between chemo drugs and other medicines the patient is taking, including over-the-counter medicines, vitamins, and supplements. These interactions may make side effects worse and affect how well the chemo drugs work. It is very important that you tell your doctor about all medicines, including over-the-counter medicines, vitamins, herbal or dietary supplements you are taking, even if you only take them as needed. This is where we work again as a multidisciplinary team and utilize our pharmacists to review your current medications. There are some medications that can affect the ability of the liver to metabolize chemotherapy. This can affect how long the chemotherapy is in your system and affect your white blood cell count, which are your infection-fighting cells. The most important thing is to let your team know what medications you are taking or what medications you want to take so that we can see if they are safe with the chemotherapy regimen that you are on.